Okay,
Thank
welcome.
you.
How are you doing?
I'm fine, thank you. I'm glad to be here. Thanks for having me. It's nice to be with all of you.
Awesome. Thank you so much, bro. So we're gonna go down into like just asking you questions about your journey and wanting you to share with us. But before that, I wanted us to do an icebreaker. Let's get to know you some more. So let me ask you this question, for instance. When
Yeah.
um where did you go to medical school in?
Okay, I attended medical school in Nigeria, in Ahmadu Bello University in Zaria, Nigeria. It's in northern Nigeria in Kaduna
Wow, wow,
State
wow.
to be precise.
Wow. I grew up in Kaduna, so we have that in common.
Oh,
I grew up in Kaduna. Yes, and my dad worked very briefly at ABU. So, and I also wanted to go to ABU, but I didn't get in, but it's okay.
wonderful. Nice to know that.
Okay, let's hear something else. What do you do when you're not in a hospital and you just want to, have some fun as a physician? And what do you do typically? How do you rest, relax, and all of that?
Oh, well, I play music, I watch YouTube videos.
Okay.
Um, Usually I have gospel music is my go-to, but I also read a lot and I write also.
Wonderful, wonderful. Tell me one book you're reading or you've read recently that you're like, hey, everybody should go read this book.
It's not, I read it, I'm rereading
Okay.
it. It's by Rick Warren. It says you'll get through this.
Wow, you get through this. That's awesome. That's awesome, awesome. Thank you for sharing that.
You're
Okay,
welcome.
so Ma, I just wanted to, even before we kind of start, can you tell us briefly about your journey to where you are? That is, you shared with us that you trained at the prestigious Ahmadu Bello University, ABU. It's a phenomenal university in Nigeria. Got that training, but can you kind of walk us through how we are at this point now, where you're a professor of anesthesia, obstetric anesthesia, and palliative care?
Yeah, well, thanks for asking. Yeah, it's been a long journey. It's been like full of ups and downs. I I had my primary school in Zaria, also in Nigeria. I had my secondary school also in Zaria, and then I went to the School of Basic Studies in ABU Zaria. It's like an A-level institution. Then we used to do what you call IJMB, and then it qualifies you to get into the university. So we didn't do JAMB, but some other people did JAMB. JAMB is a qualifier to get into the university in Nigeria. It's a joint admission matriculation board exam, which is done in Nigeria. But I didn't do JAMB. And then after the SBS, there's the School of Basic Studies.
Mhm.
Then I attended ABU. Well, medical school was very tough, very, very tough. And my school, Ahmadu Bello University, prides itself to be like one of the toughest in Nigeria. So it wasn't easy, and we were not so many. I think at the beginning we were just about 12 girls in my class. 12
Wow.
out of we're 12 out of about 120. But by the time we were graduating, I think we were nine girls that graduated, nine females, out of about 90 or 80. So it's not been easy. There is this mandatory year of internship in Nigeria, housemanship.
Yes,
So
ma'am.
everybody does housemanship. So I did in the same institution. I tried to get in other institutions, but it was not at the same. We didn't graduate at the same time, and I
Okay.
didn't want to wait. So I went back to my school and went to do the housemanship. It's the same as internship. It's just
Okay.
for 1 year, 12 months, and so I finished the internship in 1991, and then I had to do the compulsory also 1 year National Youth Service Corps program. I didn't want to go to where I was sent to, but eventually I had no choice
Okay, where
but
was
to go
that?
to. I was in Zaria, then
Okay.
Kaduna. I did my house job in Kaduna.
Yeah.
That time, ABU Teaching Hospital that had there were
Okay.
two branches. So the second one was in Kaduna, the kind of the urban hospital was in Kaduna, and I did my housemanship there. So after that, I was good. I went to youth service in um, Anambra State.
Okay.
Actually, while I was posted to Anambra State, but while we were still in camp, because after some weeks of being in camp,
Yeah.
they shared the state. That was when they had the new state's creation. And
Okay.
then Anambra State was split into two states,
Okay.
and I ended up in the Enugu State part. So they now have Anambra State and Enugu State. And so I ended up in Enugu State, and I served in Enugu in the government house clinic in Enugu. So that's where I did my youth service.
Okay.
It was very, very eventful. I had a very good time and a lot of experience because I was working with the personal physician to the governor and the first family and all the people in the governor's lodge and all those people in the government house. And it was quite nice. Eventually, I am glad I went to for the youth service, and I'm glad I went for the to Enugu State eventually. Yeah. So after that, I wanted to get into residency in ABU. I did get into ABU, and I wanted to do OB-GYN at that time. And so OBGYN, they weren't, there was only one female resident in OBGYN, and she encouraged me, was like, hey, it's a man's world. I hope you can cope and all that and all that. But they were taking time to put me in the department. They said I had to work in the OPD for a year or 2 years. It depends. It's only when they are,
Yeah.
happy with you, they will move you into the department. So I thought I'll get it faster another way. So I left.
Hmm.
I left ABU Teaching Hospital Kaduna then to Calabar,
Hmm.
hopefully to get into OBGYN,
Wow.
but still it was the same thing. They said I had to wait. They said they offered me anesthesia.
Hmm.
I met this very nice lady. I didn't know her before, but I went to the medical director to get the job, and he said, "I want you to meet somebody," and I said, "Okay, fine." I was very young, assuming I didn't really know much about anything. So I was like, okay, fine. So he called the lady. She came to the office and she said, "Oh, I like you. I'm going to make an anesthetist out of you."
Hmm.
And I was still like, okay, let's see you try. And, I was still intending to do OB-GYN. So eventually, I ended up in anesthesia department. So I told her, I said, I just want to work in anesthesia for about a year when I get my primaries. There's these exams you get in Nigeria that is, I mean, the residency training, you have to get primaries before you get into the department or the training area of your choice. But there were waivers in some departments that were lacking people.
Mm.
So for the primaries, they said, okay, then since you don't have OB-GYN primaries, I said, no, I'm going to stay and have it. So I was staying in anesthesia department. I was working in anesthesia, but I was studying for OB-GYN primaries. And I actually did attend the OBGYN primaries in Ibadan. That was probably 1993. I can't remember. Yeah, 1993, yes. So I attended in Ibadan, and oh my God, it
Wow.
was, I had been warned. Somebody had said, look, OB-GYN is rough. Everybody wants to do OB-GYN. At that time, everybody wanted to do OB-GYN, and it was a male kind of specialty. And I just said, well, okay, let me try my best. So I went for the primaries. I was shocked. There was the biggest hall in UCH then, University College Hospital, Ibadan. For those that know it, it's a big place. It's a very big place. It's a premier institution in Nigeria. And it had this big place. They were doing exams. And the hall
Mm.
for OB was not big enough to take all the OB-GYN candidates.
Wow.
Their biggest hall. There were like over in those days that people were not really like doing residency that much. OB-GYN had the highest number,
Wow.
and there were maybe over 300 people. And I was like, it was a meltdown for me. I was like, what is this?
Mm.
Anyway, I sat the exam, maybe not for the number, but I didn't make it.
Mm.
I didn't pass the primaries in OB-GYN that time, and but I just felt like, what am I doing? There was all men, and even though there were females, were very few.
Mm.
Maybe out of the 300, I could count like 10 or 15 females. I was like, do I really want to do this? What is this? So anyway, I I left Ibadan. I went back to my hospital, and I don't know how my head of department, the lady that I told you about, she likes me so much.
Yeah.
So she was like, "You went to do OIG primaries? How could you?" And I was like, "I'm sorry. That's what I told you, and that's what I always wanted to do." She said, "Yeah, but like, you've been with us for like 6 months. We thought you were getting falling in love with anesthesia." I said, "I am really, but I had already, like paid for the exams and prepared and all that." So she said, "Okay, no worries." So the very next anesthesia primaries I attended, and there was so much support. There was this book she kind of like sent to me. She said, I went to Lagos to do the exam this time, I think. Was it in Lagos? Yeah, I believe so. Yeah, because I did the national in Lagos.
Mm.
West Africa was in Ibadan, so I did the national primaries. So she said, go and get this book. It's in the Lagos University Teaching Hospital Medical Library, and see what you can do with it. It's just a small book. And I was like, okay. And so I went, I got the book, and it was very close to my exam, maybe a week or 2 weeks to the exam. It was very close to the exam. But I got the book, and I went through it through and through several times. And I could remember the night before the exam, there was no power supply. And my uncle normally runs his gen once there's no power. But for some reason that night, he put off the power very early. He put off the generator, and I still needed to read. I remember I had to go to the kind of balcony, to
Yeah.
the rooftop. It was a duplex, and there's a place you can sit like a garden or something. And I went, and there was light from the neighbor's house, very bright light, and there was a light from the street. And that was what I studied with.
Wow.
So I was like, not sleepy. And I still get so many things to study.
Wow.
And studied that small book, those videos we out, and then I slept a little, then I went from the exam. Lo and behold,
Wow.
guess what? The questions were like, maybe I can't remember, maybe 150 or 200 questions, I can't remember. But they were like up to 30 or 40 questions from that small book. Maybe
Wow.
not directly, but related to
Yeah.
or
Yeah.
close, very close to, or something similar to that book. And I was like, oh my God. This lady probably knew that this is like maybe their reference material. I know that she knew because she was one of the chief examiners anyway.
Yeah.
So I'm glad I listened to her. So I did the primaries for anesthesia
Yeah.
and I passed. So I was very happy. I was like, okay. So I'm not bothering with this OB-GYN stuff. It's anesthesia for me.
Wow.
I'm not going to do OB-GYN anymore. So I gave up, but I still was in love with OB-GYN. So I said, okay, maybe I'll specialize in obstetric anesthesia. So that's what I did eventually. So that's just that was the early days of residency. And then so after the primaries you get to do the part one, and then you do after 2 years you do the part two, and then you're done. It's a 5-year training program, but 5 years can be 5 plus n, where n is any number from 1 to 5 or even 10. So it was like you can get to stay much longer, to do so many, repeat things and stuff just to get through. But luckily for me, I got through in about 7 years, and I finished the residency training. It was not easy because I now went back to, I left Calabar,
Okay.
went back to ABU again.
Okay.
Then they offered me a lecturership position, and I went back to do become an assistant lecturer. That was in 1994.
Okay.
So I went back to become an assistant lecturer in anesthesia, and then I rose through the ranks, assistant lecturer to lecturer one, to lecturer two, then lecturer one, then associate professor, and professor. A senior lecturer before associate professor, then professor. So that was it. That's how it worked. So that's the story for now.
Awesome. Sorry, I just stood up to get my charger, but wow, this was such a first of all, let me say you're a great storyteller. Because as you were just telling me the story, telling us the story as a group, my mind is kind of picturing, oh, this was how things would have looked there. I think you're kind of painting a picture of the late 90s, 80s to early 1990s, thereabout. And um, at that time, medicine was very, very male dominated, not just in the West, but also even in a place like Nigeria. So it speaks about your tenacity that even in such a male dominated field, you are still able to shine. And then another thing I learned was the power of a pivot. You were going there, you wanted to do OB guy, and then ultimately you ended up doing anesthesia, right? Which a lot of people on this group kind of relate to that story because there are times we go into residency, we want to do this kind of residency, but at the end of the day, we don't get it. So can you kind of speak a little about that? Um, if you find yourself in a situation where you have to make a pivot, what should you do as a medical student or even as a physician? How should you embrace that new challenge that pivoting presents?
Well, yes, I would suggest to you to have an open mind, be dynamic, and move with the flow.
Okay.
Because like life presents peculiar um, circumstances to you. Some may be an advantage, some to you at the point in time may not be an advantage. But as a Christian and as a child of God, first of all, you need to pray about it and then ask God, is this what I want to be doing? Is this what I should be doing at this time? And listen, God speaks to people in different ways. But God also uses people and things and events to speak,
Mm,
to one. So you need to have an open mind and listen, and don't be fixated. And when you get an opportunity, I will say make the best of it. And if you even think it's a bad situation, make the best out of it, even if you think it's a bad situation. Because there's this thing they say that if life gives you lemons, make lemonade. So I can say, like that, because like when I had to go to Calabar, a strange place, a new place, I'd never been. My closest to Calabar was Anambra State, which was still like many states, 3 or 4 states in between, like
mm,
5 to 6 hours away by road. And it was a new area, new place. And even though this was what I wanted to do, but I met people you know that loved me, that liked me. They showed me affection, they showed me genuine care and concern. And you know I needed to reciprocate, and I needed to think about it. Okay, why not even anesthesia? Okay, so why not consider it? You know, why not think about it? Don't you like anesthesia? And actually, in medical school, even as a medical student, I did love anesthesia, even though it was a very short rotation. It was just 4 weeks. We had in my medical school for anesthesia, but I loved it a lot. I got to do a lot, as a medical student, and I got people to, encourage me. And up till today, one of my mentors who came to teach us as a young person in medical school, then I'm still in touch with him, and he could still remember that, I was very enthusiastic about the um anesthesia during the medical school rotation. So when I was presented with this opportunity, which I didn't make much of it at that time, I developed an open mind. I said, okay, why don't you consider it? Look at it this way. This it's nice, it's a good opportunity. There are very few anesthetists all over the world, and
mhm.
especially in Nigeria. Then they were, kind of like looking for, hunting
Wow.
for, anesthetists. They really needed people. I was a new specialty. They needed to grow it. So in contrast to OB-GYN that was male dominated, anesthesia was female dominated at that
Mhm.
time. For every 10 anesthetists at that time, there were 8 females.
Wow. Okay.
There were some males, but there were 8, and most of the leaders and the seniors were females. So it was like they used to call us the Akpan girls. It was always like Sylvia Akpan and her girls. So when I joined the department, I became one of the girls of this lady, this professor that was the head of department then, who said, "I'll make a good anesthetist out of you."
Wow.
So I don't know, maybe what she saw in me. I don't know, maybe she saw potential or whatever. And I don't even know why the medical director then called her and said, I wanted, maybe because they needed people. But there were also departments that they needed people, by all means. But so I don't know. Could it be happenstance? Could it be luck? Could it be God or destiny? But yeah, so if you need to pivot, have a good mind, do your research, do your study. When I was saying, why not even anesthesia? And I checked it, I checked the syllabus, I checked what's about, and I found that, well, it's quite, a lovely specialty,
But
quite interesting. So
Yes.
it's quite interesting. So why don't I, like some
Professor.
people there's some
I'm sorry, ma. Let me mute. Yeah, I've muted her. Sorry, ma.
yeah.
Yes.
So that's it. So if you need to pivot, have an open mind, pray about it, do your groundwork, do your research, and then find out what it's about, and go for it. Be dynamic. Yeah, that's what
Okay, that's
I can
awesome.
say.
Thank you so much. From just what you've shared again, that's so powerful. You're saying that we should make lemonade out of the lemons we're given, and that whenever it can happen that you just have this opportunity to pivot, you should take it and all of that. But something that stood out in your story was Professor Sylvia Akpan, your mentor.
Yeah,
Can you
yeah.
speak about the power of mentorship? That is, one, in terms of mentoring others or even receiving mentorship yourself. How has that played out in your career so far?
Yeah, so mentorship is very strong, very powerful, and it can make you or mar you.
Hmm.
You need to have good mentors at every stage of your life
Hmm.
for every major, like decision or major process that you're doing in your life. And also, you need to have a good mentor-mentee relationship. You need to like your mentor or love your mentor or
Hmm.
see something good in a mentor. So who is a mentor? A mentor is like a teacher, a guide, can be a friend, it can be a contemporary, can be a senior colleague, it can even be a junior person. There are times where you have, like people you consider to be junior to you, but you're getting mentorship from them for a certain aspect of something you've not been able to do or achieve. So it's not necessarily always an older person.
Okay.
So this mentor of yours, it should be somebody you are looking up to be able to achieve something that you don't have, which that person has already, And
Hmm.
so the mentor will be able to guide you, should be able to say, okay, this is what you should do. And you, the mentee, should be able to take the guidance, take the leadership, take the suggestions. And also, it's not every mentor mentee relationship that you just hit it off,
Hmm.
or like it gets, because some mentors, they just choose you. They say, look, I like you, I want to do this. Like this lady, she chose me.
Hmm.
Okay. But there are some mentors you choose by yourself, or you look up to them, or maybe your parents or your senior colleagues or people that maybe from school days, you're looking up to them, you know. Uh, but at other times they can be assigned to you. Like, in college, there are some college programs where you are assigned a college guide, a college advisor, or a mentor, or something like that, you know. And sometimes it can just be happenstance that you people just, you know, happen to be just paired together. And sometimes it may not be a good match.
Hmm.
So the mentee relationship, it's not always all rosy rosy.
Mm.
Sometimes you may have a mentor that you dislike,
Yeah.
or you don't find what they're asking you to do to be pleasurable or whatever at the time, at the point in time. And then there are some that are, definitely clearly, on, uh, you know, not nice. You don't really like them, So you can actually break a mentor-mentee relationship if you feel that it's not working out for you,
Mm.
or it's not giving the good starts, or things are going awry. So there are pluses and minuses about it, but generally on a good day, a good mentor is supposed to be it's supposed to be a plus for you, supposed to like buoy you up, give
Mm.
you access to a lot of things, in your career. So I still believe in the power of a good mentor
Okay. That's
relationship.
wonderful. That's wonderful. So, what I'm hearing you say is that there are mentors who can actually be advocates for you, sponsors for you. They would
Yeah,
mention your name in rooms. But there are also mentors that are tormentors, right? For lack
you
of a
got it.
better, I didn't come up with it, but there are mentors that can be tormentors, and you should also feel free to retract your steps if you feel like that is not a good fit for you.
Yeah.
That is very great. So one question that I had for you as well is, in your own words, what would you say distinguishes a good doctor from a great doctor?
Yeah, both are good,
Yeah.
but thank you for that question. It's a nice question. It sounds basic, but
Yeah.
it's also, a slightly difficult question
Yeah.
because it has a lot to do with perception,
Mm-hmm.
and it has a lot to do with also your output. So um, a good doctor is
Yeah.
the one that, maybe crosses all the T's, dots all the I's, does what you expect them to do as a doctor. And, they see their patient, they go to the ward rounds, they do their clinician work. And if they're into research, they do their research work. If they're, whatever aspect they're doing it fine. But a great doctor, I believe, goes an extra mile,
Mm.
goes the extra mile to do other more special things for themselves, for their patients, for the community, and maybe the institution where they work. So a great doctor, has, you know, add some extras
Mm-hmm.
to the basic crossing the T's and dotting the I's and checking all the boxes. The great doctor goes an extra mile,
Mm.
and, makes it a kind of a personal thing. I think to be a great doctor, you need to have a passion. You need to love what you're doing. You need
Mm.
to, you know, believe that what you're doing, you're making a difference, a positive difference. You're impacting your people, your community, your patients, your generation positively by what you're doing. And so you need to believe in yourself, you know, to be a great doctor. You need to, um, you know, also have the faith that when you go out there, you're going to touch a life in a special way. And yeah, so it's a bit difficult, but um, His grace is sufficient for us, and His strength is made perfect in our weakness. So, if you are having difficulty or you want to be great, you want to go an extra mile, to be more than what you already are. You need to trust God to be able to help you to do that. So that's what I
Awesome.
can say.
Awesome. Thank you so much. So a great doctor is a passionate doctor who goes the
Yeah.
extra mile. Okay, I'm learning so much here. So, for so many of
Yeah.
us, we're still at the very beginning of our careers. Was there ever a time that you thought about quitting medicine? That you're like, this is too much. This is like, because medicine kind of takes over your life. It's like everything that you for many, many years, some of us use our early adulthood really just focused on medicine. So, was there any time that you just felt like, you know what, enough with this thing? And how did you come out of that?
Oh well, I've never really felt like quitting, as in quitting for good, but I've felt like oh, I need a break,
Hmm.
or oh, doggone it, I'm just I need the time. I need some time out. I've never really felt like quitting, but I felt like, oh, this is a little bit too much.
Hmm.
So when I do feel like that, I do a lot of traveling.
Okay.
Tra- Traveling is one of the things that I found to be like, it could be a booster for me, a morale booster, and I could use the time to reinvigorate myself,
Hmm.
know. So, and I just don't travel like randomly.
Hmm.
It's purposeful traveling. So early in my career, I will look for conferences that I want to be in,
Okay.
uh, update courses, maybe, you know, um, workshops and things that are relevant in my field that I want to be in and I know could help me, could be pivotal to take me to the next stage in my career, or could be a very important part of my CV. So I I used to travel a lot. I Some years I could travel 3, 4 times.
Hmm.
It was easy at the early stage, especially with marriage and young kids and all that. But somehow I found a way to do it, and my husband was very supportive.
Hmm.
So he he became like my travel planner, like my
Okay.
event planner. For everywhere I needed to go, he will find one uncle, one cousin, one niece, one somebody like
Hmm.
that he will know that maybe I could meet or I could stay with, or that could just give me information or a lowdown about the city and all that. So that was a great help. That was a great help. So that's one of the things I do to wind down so that I don't get it doesn't get overwhelming.
Burnout. Yeah.
Travel-
Yeah.
Yeah.
No, that's so powerful because I think you're right that in medicine it's easy to get into that state of burnout. And maybe at that point is where we start rethinking our choices that, should I really continue on this path of medicine? But it's good
Mhm,
as it's shared that break out from the routine, go
mhm,
somewhere else and try to get, refreshed again. And that can be helpful. And that will look differently for different people.
mhm,
For you, it can be travel. Some people might just, for me, I like, for instance, taking daily walks just to kind of clear my head out. But those are very important things. There's someone that once shared that if you have a high demand life, you need a high supply life too. So that means if you're working, which medicine entails, you really need to pay attention to self-care. Something you mentioned towards the end of, your last response was about managing, family, children, and everything like that. And I just want to give a shout out to you specifically that you've raised really amazing ladies, some of who are members of this group, and we're super grateful for. I just keep thinking, I'm like, how come everybody's a doctor in the family? kind of walk us through what it was in terms of um, managing everything. You're a physician, but also a mother. Many of us are stepping into that. How was it for you?
Yeah, okay. So it was thank you for that question. Work-life balance, it's not a walk in the park.
Hmm.
It's it can be quite challenging. It can be quite difficult. You're gonna need a lot of help, support, guidance, a lot of things at different times.
Hmm.
So yeah, what I found that I got married when I was already a senior registrar.
Okay.
Uh, yeah, I was a senior registrar and a lecturer too at the Ahmadu Bello University at that time. So it wasn't easy, combining work and anesthesia schedules can be very, very demanding. You work all day and maybe you're on call all night. And because we were not many at that time, we never used to have gas off days. Now there is this thing that we try to encourage now that if you have done an overnight or a 24-hour call, you
Mhm.
should go off and take a rest and be off work at least in the morning hours of that day and then come back the next day. But we didn't have that during the time I was starting residency. In Calabar, I was not married. When I moved to Zaria, I was not married for the first few years. Then I met my husband and we got married. It was not easy because I was very, I was the most senior resident in the department at that time. And we had only one consultant. And then after a while, I think he left and there was no consultant. And we were just like two or three residents in the department. And so there was nothing like gas off days, nothing like off days. You take alternate day calls and you're still at work the next day. So it was very challenging and very tough on the family.
Hmm.
Um, I remember when I had my first child, my son, and they used to, I used to bring him to work. I had somebody stay with me, and then it wasn't possible because he was very young, and so my mom said, "Okay, she will stay with me and they look after the baby, and then sometimes she'll bring him to the hospital and sit in the office. We had a departmental office. Then I'll go to work, and then maybe in the middle of a case or in between cases, I'm in the OR. They will just call and then just put his voice, and I'll just hear in my earpiece, just uh, crying.
Wow.
I'll just hear a bawl and I'll be like, what is that? They'll say, your son is crying, you know? They'll be like, your baby is crying, he needs your attention. Or the food you have left has finished, or the milk is finished, everything is out, just wherever you come around. And then so we worked out a way to like have him have a I got a nanny, so they'll bring him to the OR, and that was during working hours. But she will go home because it was a daily nanny, so and it was not working because after work, if I'm on call, call, it was still very difficult.
Mm,
Um, the father will have to take the baby and, kind of like manage, see what he can do. And then it's not working. He will bring the baby to the hospital and all that. Luckily, we're living inside the hospital, so it wasn't far or anything. But what I'm trying to say is that it can be quite challenging. And then when
ah,
you have
ah,
many kids and one child after the other. So it was one of the things that made me very passionate about um, female doctors and their families and their kids.
mm,
So when I had the opportunity in the Medical Women's Association of Nigeria, I created a crèche
mm,
in our hospital, and it's in existence till date. I went to the medical director and I said, well, it's a very difficult thing. We can't do this. So I said, okay, let's have a partnership with the management and the Medical Women's Association. It said, identify a space where you can use. So I went around the hospital. He gave me people to take me around. And we saw three potential spaces. And then we like said, okay, they'll put the, furnishing and everything and get people to work there, nurses and nannies and all that. So if you're a female doctor at work, you come, you clock, you drop your baby and then go to work. And then after work, you just go and pick your baby. Or sometimes they have an arrangement where they can keep the baby for extra hours for you by special arrangement. You keep all the care needs, and we drew up all the protocols, all the stuff, all the ground rules. I drew that up. And till date, I'm happy to tell you that it's in existence and it has become a norm that
mm.
they has to be child care for young female doctors so they can take care of their babies. And so they didn't go through the nightmare that I went through, during my time because I was more like a pioneer. So, yeah, so these are some of the things. Work-life balance is not easy, but it's doable.
Mm,
I had to go through, my first daughter. It was rough throughout her pregnancy. I was doing my part two dissertation. That's the final stage of my book. And the people I used to go, it was not like now you have a PC, you do everything yourself. I had my PC, but I couldn't do that. So many things they were doing, typesetting and stuff they were doing for me. So I would go there almost every day
mm.
after work. And the people said, hey, madam, doctor, this pikin where you go carry, you must to become doctor. In Nigeria, spoken English. That's like this baby must be a doctor because all the things you're doing, you know. So, and lo and behold, she is now. But it was not easy. And then I had to take her for exams. It
Mm,
was also not very challenging. My final exams when I was in my part two, I had to take, and then she just fell ill. And I spent the 2 days before the exam, we were in the ER and then we were on admission. And I had to tell them, look, I have an exam. I have to go. I was in Lagos. My sister was living in Lagos there. My elder sister, I was with her family. So, and then we had to, like, from Lagos to Ibadan to go and attend my exam the same morning with a sick child. The exam results, okay, it was like I had my part two, the book defense and the dissertation. Okay, book defense went well, but the dissertation I was all over. Everybody was like, "What's happened? What happened? What's wrong with you?" And I just opened up to one or two people that my daughter has been ill for the past 1 week. I just came for the exam. I just came like that. So it can be quite challenging, but we just have to, like, face it and do the best that we can. And we need help. We need to get nannies. We need to get childcare
mhm,
facilities somehow, and then we need a supportive family, husband, mother, sister, auntie, whoever. In Nigeria, it's still a little bit easy to get, but
Yeah.
out there in the diaspora, it might not be so easy to get childcare or child support. So some people have had to, have only one child or even stop having children until they finish their residency training or something like that, because combining it can be quite challenging.
Wow, thank
Yeah.
you so much. First of all, I mean, thank you for pioneering and coming up with that initiative. It's something that I'm learning too, that when there's a problem, you need to try to help find the solution and support in that way. And you're right that maybe sometimes we'll have to outsource, right? We have to, if we need to get a nanny, we need to get even a cook, who knows, a cleaner or something. But and hopefully as we advance in our careers, we're able to get there. But thank you so much. That is so. Let's give mommy a round of applause for that initiative. Just think about it that many people who now go to many doctors like ourselves now are having the crash opportunity and all of that. Now I'm going to open the floor to you all. Is there any question you have? I know and I really love having you join us today. The reason why we came up with this concept was so that members of the community can see the picture of possibility. What is possible is very, very important to see that, oh, this journey now, I'm just at day zero, but at least I'm seeing somebody who has gone through day 1000 day or year, who is more advanced and being that picture of possibility, we really, really are grateful for that. Any other questions from the group? Any other questions from the group? Okay. One more thing, yeah, when we were just chatting briefly before, days before the talk, you did mention that you're in Saudi Arabia right now.
Yeah.
Would you kind of talk to us about that? Because it seems, from the story, we kind of stopped at you were in Nigeria. So how was that journey, you know, to where you are, and how is practicing outside of Nigeria feeling like?
Yeah, okay, thank you so much. So, yeah, I came to Saudi Arabia. It's about 5 years now.
Wow.
And I wanted to like work outside Nigeria for a long time. Even in my younger days, I had this opportunity to work in the UK, but like because of the family and all that, and I got a job, but I was not. I was given a visa to go without my daughter, and my daughter was just a few months old then.
Which daughter is
I
this
get
one amongst them? Which of them? Is that person on this call? Because that person showed you some shade in
Esther.
our season. Okay.
So Esther, but I still went, but I couldn't
Okay.
stay long. So Esther was the one. Getting visas in those days was so difficult.
Okay.
It's still difficult, but it was even more difficult then. I had to get a letter of approval from my husband to say he accepts that I should go. And I told him I wanted to
Wow.
go. My daughter, because she was still suckling, and maybe like 7 or 8 months old. And I had to, so many things I had to do. I kept going for the visa rejection. The first time I appealed, the second. So finally, they gave me the visa without the daughter. So I said, okay, I'll still go. So I just went for a short course in obstetric anesthesia. And then I came back. So um, then later I wanted to get to the US. Then there were so many other obstacles here and there, you know, not just family, visas and stuff. I got a job again. But my husband was like, how will the family be and all that?
Hmm.
So I said, okay, let me just manage. But eventually, in 2020, some life defining moment came, and I really needed kind of like a change of environment to clear my brain, because I was bereaved. That was when I lost my husband, and it was COVID time, and a lot was happening. So I said, okay, let's go to the UK. We did go to the UK,
Mm,
and I tried to get a job. I tried to do so many things, but it wasn't working out. So I said, okay, whatever. While I was still in the UK, I got this opportunity to the first job I got in Saudi. That was in 2020. And like I was asking a lot of questions, insisting on this and that and that. And I interviewed for the job, and then they, you know, wanted me to do so many things. And I said, okay, no, I'm not taking this job.
mm,
But again, something else happened. So I got another job, and I said, no, no, this time I'm taking it. I'm not going to. So working in Saudi Arabia is an opportunity. There's still opportunities for doctors to work, but now you have to be a specialist.
okay.
Um, so in the past, you could work as a medical officer, but I think for about 4 or 5 years now, they've stopped those medical officer jobs.
Mm,
It's only those that are on staff that are there now. But if you're a specialist, you can get a job, especially with things like OB/GYN and anesthesia. Especially
mm.
if you're a female, they would like to have a female OB/GYN
Oh, God.
anesthetist and all. Yeah. So when I got there, it was a culture shock.
Mm.
Even though I was used to, like the environment in a little way,
Maybe you
because
grew up
I
in
grew
Zaria
up
a little,
working.
yeah.
Yeah, I grew up in Zaria, so the environment was no, but it was really, really much different from what I was used to. So the dressing, the work, you know, very strict work environment,
Mm,
and you have to be at your best, you have to be top notch, and then there are exams. You have to get the medical license so that you can practice. In the past, they used to allow you to start the work, and after 3 months, you get the licensing, and then you continue. But I'm told that now it's a bit more difficult. You have to get the license before you get the job. Although there are still some
mm,
waivers here and there. So working in Saudi Arabia, it's quite challenging, but it's nice. It's an opportunity. The pay is relatively, yeah, good. At least one of the things I discovered was that it was better than what I was being offered in the UK, because I did get a job in the
oh,
UK. But when I did the math, I saw that,
mm,
yeah, even though UK would be nice for me, family friendly and all that, my kids who go to school and all that, but I just prefer prefer to remain in Saudi Arabia. And my daughter that was still young then finished her grade school
mm,
and A levels in Saudi. So she went to an international school. So it's okay. It's a good opportunity if you can take it. And for young people, it's fine. There are still young ladies who are here and working and having their family, and some are female doctors' wives, some are also some are male doctors' wives, and some are female doctors that are also doing their career. But the only problem is that they don't train you. You cannot train here. If
mm.
you come as a medical doctor, you can't get any training. So people use it as a springboard to do their exams. Some do their USMLE, some do their PLAB, Australian exams, Irish exams, and go over to where they want to be. So, yeah. So
Nice.
it's an opportunity people can consider, and it's good. Just know your work and do your best, and trust God all the time.
Wow, that's so powerful. Like your story is very inspiring because we see the days in ABU of training and you wanting to do OB/GYN, then pivoting to anesthesia, thanks to mentorship from Professor Sylvia Akpan, and then proceeding to just, blossoming in Nigeria, and then life hit you hard with the loss, and then you had to pivot again and reinvent yourself, and now you're in Saudi thriving. This is wonderful. Can we give mommy a round of applause? And if there is no other question, I really want to give her back her time, because today it's already probably after 8 p.m. in Saudi. So we're so grateful that you took out time to spend your Saturday with us. It's not something we take for granted. And we know that only God can bless you and just continue to multiply and increase you, and that um, you will continue to reap the fruits of your labor. This wonderful children that you have invested so much in, they will always be source of pride and joy to you, and you never have any cause to sorrow. For in Jesus' name we have prayed. Let's just thank her so much. Go in the chat. I want to say go crazy, but don't go crazy. Just celebrate her, celebrate her, celebrate her. That we're so grateful. We're so grateful. So, so grateful. And now celebrate yourself for staying to the end. This is wonderful. Thank you so much, everybody. And even those who joined us as as affiliated to Mommy. Thank you, Sir Solomon Akponye. Thank you, Sir William Kadri. Thank you to Professor Adedayo Adio, Dr. Adeleye. We thank you so much. Dr. Patrick, who joined earlier as well. So we're super grateful. And hopefully the word kind of spread more about our community. We are an international group. We have people from all over the world who are women who are in medicine, whether they are medical students, medical doctors, or nurses, um, people who are in just different fields that are very interested in serving God and serving people through medicine. I have one question before I go off or we go off. If you're applying for the residency match this year, please do us a favor by sending us a message, or you can send me a message from the group privately that you're applying this year, so that we can maybe come up with a group and see how Women of Faith in Medicine can serve you specifically. Do not forget that our next meeting is a prayer meeting that is happening in July. And I know the program director just joined briefly. Now, I don't know if she's still on, but it will likely be July 4th, where we have our next prayer meeting. And please come, let's join as we pray for our careers, pray for our application, pray for everything that we're doing. And with that being said, I will hand you over back to your Saturday. Thank you, thank you, thank you, thank you so much. Have a good rest
Can
of
I
the
say
day.
something
Yes, ma'am.
before we shout
Oh,
out?
yes, ma'am,
Before
please.
we sign out, I want to shout out to my kids, Elizabeth, Esther, Victoria, who I think are here. Then I want to shout out to my son and my baby daughter, Justina. They were amazing children. I could not have done anything without their support at every stage. They went with me to every conference, every exam, like every. And they've been so amazing. They've been so amazing. And all the nights of absence, all the time of travel, all the time of update course, revision course, teaching in fact, a lot of people began to know them because I was like traveling and doing a lot with them. And so I want to just say shout out to them. Thank you so much for your support. And I couldn't have done anything without you.
That's
Thank you.
wonderful, wonderful. And I just wanted to add to that they have also been a blessing to us as a community too. We had Liz, Esther championing a lot of our social media outreach and efforts to spread the word about the page. So we're so grateful that we get to share them with you. So thank you very much, ma.
Thank you. It's been my pleasure. I'm glad they could do that.
Yes, man. So thank you so much, everybody. Have a great rest of your day. Bye bye. If you wanted to stay behind and chat with me, that's also fine. But bye bye. Bye bye. And you
Bye.
can turn on your camera to say bye bye or unmute to say bye bye or something.
Bye
Bye
bye.
bye.
Thank
Bye
you.
bye.
Thank
Bye
you.
Bye,
Thank
Bye.
you
Professor
Thank you
for
so
Elizabeth
much.
having me.
Nwasor.
Bye
Thank
bye.
you.
Nice
Bye
to
Thank you
hear
bye.
so
you.
much. Thank
Thank
Really
you.
you.
enjoy your
Thanks for
lecture,
Thank you so
coming.
much,
Prof.
Onuwa
Thank you so much.
Ogboli-Nwasor.
God bless
Thank
Thank you
you.
so
you.
Thank
Thank you
much.
so much.
you.
Thank
Thank you.
you.
Stay till the end. Thank you, Mr.
Thank you.
William.
Thank you for staying. Thank
Thank you, sir.
you.
Thanks to all the people I shared the link
Oh,
to.
yes.
Hello, Professor Adio. How are you, ma?
I'm
Thanks
very
so much.
good. Thank you, Professor Elizabeth. Nice to
I'm
hear you. Looking
so
so
happy.
beautiful.
Thank you. I'm glad you could join us. Thank you so much. I appreciate
Yeah.
you.
All
Wow.
right.
Thank
Thank you so much.
Bye.
Thank you. Thank
you.
you. Thank you
Hi,
so much, Ma.
Dr.
Thank you, Ma.
Onye. Thank you. I
Yes, sir.
appreciate you.
Thank
Thank
you
you
so
so
much, Ma.
much.
I'm so grateful.
Okay. My pleasure.
Yes, Ma. God
Thank you,
bless you,
Dr.
Ma.
So.
We're so grateful.
Thank you. Patience. Patience. How are you? I see you. Thank you.
Thank you. Thank you for waiting till the end. Thank you so much. Okay. Bye-bye.